Hi, Victoria. I'm so pleased to have the chance to talk to you today. Could you please give a brief intro on who you are and what you do both professionally and for docbotic?
Yes. Hi, Dasha. Thank you so much. I'm excited to chat with you today. I'm a licensed clinical psychologist that specializes in health psychology, and I focus on empowering people to live more fulfilling lives by addressing anything that might be getting in the way, such as poor sleep. At docbotic, I'm the clinical product director, and part of my role is to make sure that our interventions are clinically and scientifically sound.
Wow, it's awesome that Sleepbot is developed and supported by professionals like yourself. So let's jump straight into our discussion of sleep health and how Sleepbot can be a helpful tool. What is disturbed sleep exactly, and how serious are the implications for mental health and general well-being?
Yeah, that's a great question. Broadly speaking, sleep disturbance can be caused by any condition that makes it difficult to fall and stay asleep and significantly reduces sleep quality. Insomnia is just one of the most common conditions that causes a sleep disturbance. And sleep and mental health and well being go hand in hand, and sleep is important for recharging the brain and body at the end of every day. So, if you've ever had a night of bad sleep, the next day you probably felt pretty low energy, more irritable, and not as mentally sharp. So, experiencing poor sleep on an ongoing basis can increase the risk for developing or exacerbating mental health or physical conditions such as depression, anxiety, and even heart disease. So, getting good sleep is important to maintain optimal mental and physical health.
Clear, clear. Thank you, Victoria. To expand a bit on the topic of insomnia, what characterizes this condition exactly, and how is it typically treated?
Yeah, insomnia is a common sleep disorder, and it is characterized by difficulties with falling or staying asleep or getting good quality sleep. Many people experience short term insomnia at some point in their life, which usually lasts for just a few days or weeks, and it is the result of stress or some event that interferes with sleep. However, some people have longer term or what is called chronic insomnia that can last for several months. Now, insomnia can be treated with cognitive behavioral therapy for insomnia or CBT-I, which is recommended as the first line of treatment for insomnia and helps you develop healthy sleep behaviors. Insomnia can also be treated with prescription sleep medications.
Sleepbot was actually developed on the basis of CBTI, except it's in the convenient format of a chatbot rather than a physical psychotherapist. Could you tell us a bit about how CBTI works and how effective it is?
Yeah, well, CBTI is a short, structured, and evidence based approach to improving sleep quality. There are a few components to CBTI treatment, which includes improving sleep hygiene, addressing and reframing any unhelpful thoughts or beliefs about sleep, and developing sleep habits and behaviors that help you sleep well. Extensive research has established that CBTI is an effective and safe treatment, and it is often as effective or more so than prescription sleep medications. And really, almost anyone with sleep problems can benefit from CBTI, but it does require steady practice. So stay with it, and you'll likely see lasting results.
Cool. As you mentioned earlier, disturbed sleep and insomnia often have a negative impact on mental health. Would you say that by treating disturbed sleep and insomnia using Sleepbot, those struggling with anxiety and depression could alleviate some of their symptoms?
Yeah, although Sleepbot is focused on helping people improve sleep, it might indirectly affect mental health symptoms and general well being. So, because there is such a strong connection between sleep and mental health, as your sleep quality improves, you might also feel more emotionally balanced and more capable in coping with distressing mental health symptoms.
Victoria, thank you so much for taking the time to share some interesting and useful information with our viewers today. And if any of you watching find yourself relating to sleep problems, sleep disturbance, and insomnia, I do recommend that you check out Sleepbot. We're currently running a free trial, and maybe it can be a useful tool for you as well.